Okay, so we want to talk next about the planning piece of the nursing process. So we've done our assessment and we've noticed what's going on, and we've put that information together into patterns, and we've decided on some of our patients' nursing needs, some of the things that are our priorities of care in nursing, and we've given those things names using the NANDA system. Okay, so the next thing is planning. What are we going to do with that care? So how do we prioritize? How do we decide what's the most important priority? Our patient is struggling to breathe. He has low O2 sats. He also is complaining of constipation, and he has a wound on his heel. Which one of those things is the most important? Okay, which things do we address first? So there are some frameworks for choosing for a prioritization, but one of the simplest, and this is what I use with my freshmen a lot, is what's going to kill them first. Okay, so think about what is the greatest threat to life or function that that person faces. So we can look at ABCs. Past the ABCs, airway, breathing, circulation, we can look at whether the problem is an actual problem or a potential problem. Now, we don't always prioritize actual over risk. If the patient is constipated, but they're at risk for suicide, we don't prioritize that constipation over the risk for suicide. So we don't always do that, but sometimes things, prevention may not be the highest priority over an actual need. So think about, again, what's the greatest risk to that patient's life and function. We also need to look at the severity of the need and the patient investment in that. If your goal is for your patient to stop drinking, and they have no intention of stopping drinking, that really can't be your priority because you can't make them stop drinking. Okay, so think about the patient investment and think about the severity of the need. Maybe the patient has some mild respiratory involvement. Maybe they have some wheezes, but they're moving air pretty well and their sats are 95. They still may have some impaired airway clearance, but maybe they have a fecal impaction. That would be a higher priority. Constipation would be a higher priority than their airway clearance because of the severity of that need. So I think you have to use that as well. We sometimes use Maslow. There is an updated Maslow hierarchy of needs. The bottom level of that is physiologic needs. Okay, and that's things like food, water, shelter, clothing. The next level is safety and security. So most people, Maslow's hierarchy of needs is about how most people approach getting their needs met. It is not a hard and fast ladder because humans are individual. But most of the time, we're going to prioritize our physiologic needs. If we're hungry, if we have to pee, we may risk our safety to meet those needs, right? So safety and security is the next level. After that is love and belonging, and then esteem, and then purpose and meaning, and then self-actualization. So we usually in nursing are working, our priorities are toward the bottom of that. We're worried about their physiologic needs and we're worried about their safety and security. And then hopefully we're worried a little bit about their love and belonging and their esteem, self-esteem. So those are some ways we can look to prioritize. But really, I want you to think, just look at the patient and think, what's the most important thing this patient needs from me? If you're having a hard time figuring out what their highest priority needs are, think about the care that you want to give them. What do I want to do for this patient? Why do I want to do that? If I want to straighten the patient up in bed, I look at that patient, I want to straighten them up in bed. Why do I want to do that? Okay, is that for comfort? Is it for oxygenation? That's going to help point us toward their needs. We have a structured way that we do goals in this program. So when you write your care plan, As of right now, we're actually looking at different ways to care plan, but as of right now, when you write your care plan, we have a structured way that we do goals. We do a long-term goal that's aimed at the diagnosis, and we do short-term goals, usually 2, aimed at the etiology. Okay, so our patient who has pneumonia, he's got ineffective or impaired gas exchange related to excessive mucus, bronchoconstriction, and poor thoracic expansion, right? Our long-term goal is going to be to fix his gas exchange. So my long-term goal is always going to be either his O2 sats get better or his blood gases get better, always, okay? Because the problem I'm focusing on is gas exchange. So my long-term goal is going to be something like patient will have O2 sats greater than 94% within 30 minutes, okay? Or I could say greater than 94% without supplemental oxygen within 2 days, if I'm looking further away. Short-term goals are to fix the etiology. And you can have more than one etiology. So my short-term goal would be that if I open his airway, how am I going to know that? I'm going to know that because I'm going to hear air movement. So patient will have increased air movement identified on auscultation. Patient will have air movement noted in all lung fields. A patient will have no wheezing and clear air movement. Okay. How am I going to know if he starts coughing or if he gave it away? How am I going to know if he has less mucus in his chest? I want to see it start coming up. Okay. How am I going to know if he's getting better chest expansion? Again, we're going to look at is he in a better position, but also is he, are we hearing air movement throughout his chest? So my short-term goals are going to be to fix the causes of the diagnosis. Okay, so we've got a problem, we've got causes. Long-term goals are that the problem is fixed. The short-term goals are the causes are fixed. That's why it's so important that your etiology, your causes, are things that nursing care can address. Because if I said impaired gas exchange related to pneumonia, what goal can I set as a nurse that his pneumonia is fixed? That's not a nursing problem, that's a provider problem. So I've got to look at what the pneumonia is doing to that patient's body, and that's what I want to fix as a nurse. Goals should be SMART. They should be specific, measurable, attainable, realistic, and timed. What does measurable mean? Specific, you just be specific, not vague, right? Measurable means that if I say this is my goal and someone else reads that goal and looks at the patient, they can decide, they can determine if the patient has met the goal. So if I say patient will have decreased pain, and that patient's pain goes from 8 to 7, I might think that's not enough of a decrease. Someone else may think 8 to 7, that's a decrease, the goal's met, okay? So instead I'm going to say patient will report pain less than 4 of 10. So when that nurse goes and assesses the patient, and the patient says their pain is still 7, no, that goal wasn't met, the goal was 4. That's what measurable means. Can another person come behind you and assess that goal? Okay. Attainable and realistic. We wanted our patient with pneumonia to have O2 sats above 94% on room air within 2 days. Okay. If that patient has had COPD and has been on oxygen at home for 10 years and their O2 sats are 91% on a fantastic day, are we going to attain that goal? Is that patient going to attain the goal? No. Okay. So specific, measurable, attainable, realistic, timed. When do we want that goal to be met? Goals are stated in terms of patient. So not nurse will, but patient will. A frequent mistakes students make is their goals are actually interventions. So my goal is not going to be that the patient is straightened up in bed or that the patient gets his breathing treatment. My goal is going to be the patient's oxygen level and that his airways sound clear when I listen to him, right? That's patient focused. You assess whether the goal has been met. Interventions are the next lecture, and they're what you do to achieve the goal. You need to have heard of NOC. I've not seen it used in practice, but you need to have heard of it. It's nursing outcomes classification, and it's a standardized list of nursing sensitive outcomes with scale for measuring the progress. So if someone says NOC, you can be like, that has to do with goals, and that's about all you need to know. So we set goals, we decide what we want the patient to look like, and then when we choose interventions, we want to plan the interventions that we think will achieve the goals that we set. The next section is going to talk more specifically about the types of interventions that we might choose.